I'm in no way coming for this physician. I think it's absolutely horrific what's happened. But I do want to talk about the things that contribute to this kind of result. Medical gaslighting, medical dismissal, and medical misdiagnosis. We know there's been studies done that tell us that people who have chronic pain, they're not believed. We know that doctors literally think that people, just because of the color of their skin, they don't feel pain at the same rates of everyone else. There's literally studies about that. Like, it's the reason Black women die at the hands of doctors more than anyone else. Okay, but this medication thing, this over-the-counter medication thing, how does this happen, right? This is how it happens. You go to the doctor with a complaint, and they tell you it's normal. You go to the doctor, and they tell you it's all in your head. They give you this medication, and that medication doesn't work. So then they tell you to just take XYZ over-the-counter medication. But they never tell you that this should be for acute, short-term purposes. And when you go to the doctor, you know that you're not going to get relief anyways. So you just decide you're just going to do the easy thing. You're just going to take the over-the-counter stuff because that's what the doctor told you to do anyways, right? So that's what you do. In fact, this is actually a big issue in my household because my husband and I, we've been together for like 13 years, and he's seen me deal with severe debilitating pain like this whole time. And he never understands when I am having a really, really bad flare-up why I won't go to the doctor. He can't fathom going to the doctor and people not helping him, because that's never been his lived experience. But I've been dealing with pain and symptoms since I was 5 years old, and nobody did anything about it or believed me or listened until 25 years after the start of that, when I was 30. So I don't trust the medical field to help me when I go to the doctor, and that is many people's lived experience, and that is why this happens. And so I'm not blaming this doctor. I'm not blaming any single doctor. I'm blaming the entire medical field. I'm blaming the entire system, because these doctors are expected to walk into an office and help a patient within 5 minutes because they have to see, XYZ number of doctors. They've got patients. They've got this quota of people that they need to see in this, and these people who are making these decisions for them, who don't even treat patients, are telling them how long it should take to treat a patient. Doctors literally are told they can only see pelvic pain patients for two of them a day. They can only see pelvic pain patients 2 a day because they take too much time, because they cry too much. So that's why they end up waiting months and months and months for help, and then they go to these over-the-counter medications. And this is shit that happens because nobody believes us. The chronic pain community, we're fucked over a lot, and it's because nobody believes us. So that's nice.